My name is Eamon Quigley, and it's a great pleasure for me to be with you today to talk about a new approach to the treatment of chronic constipation. Here's a little about my background. So let's start with the question of what are the challenges for patients with chronic idiopathic constipation. I've listed these on the next slide. Firstly, it includes efficacy. Is this agent going to be effective in the short term? And is it going to maintain that efficacy over the long term? Because after all, chronic idiopathic constipation is a chronic disorder. Furthermore, is it going to be effective regardless of the patient's presentation? Will it be well tolerated? Will it cause diarrhea, urgency, and incontinence, or lead to other symptoms which are so distressing for patients such as cramps and bloating? Predictability is a very important issue for patients with constipation. In other words, will they have a bowel movement when it suits them and not have to be positioned next to a bathroom for the whole day? Finally, and this is very important given our more novel concepts of chronic idiopathic constipation, which includes not just reduction in bowel frequency, but also many other symptoms, will the new treatment address all of these chronic idiopathic constipation symptoms? So before we talk about any new treatments, let's discuss what are the currently available treatments and their mechanisms of action. Here I've listed the various approaches to the current management of CIC. We often begin with diet and lifestyle, then go on to fiber supplements, progress to over-the-counter laxatives, then move to suppositories and enemas, and then prescription drugs. And here there are two broad categories: secretagogues and prokinetics. There are also a number of agents that are used off-label as prescription agents, and of course for some individuals biofeedback and pelvic floor retraining may be appropriate, and very rarely surgery may be indicated. So let's look at these currently available treatments. As I mentioned, the starting point is usually dietary and behavioral changes. Then we move on to over-the-counter products such as polyethylene glycol, like Miralax or Dulcolax, and then to prescription agents, which are listed over on the right. Polyethylene glycol functions as an osmotic laxative that causes increased water retention in the lumen of the colon by binding to water molecules, thereby producing loose stools. Bisacodyl stimulates adenylate cyclase, increasing cyclic AMP, leading to active transport of chloride and bicarbonate out of cells. It also decreases expression of aquaporin-3, preventing water from moving into the vasculature, which may contribute to increased water in the colon. And it stimulates parasympathetic nerves in the colon, stimulating contraction of longitudinal muscle, but not circular smooth muscle. Moving on to the prescription agents. Linaclotide works by activation of GCC receptors by linaclotide itself, which results in the elevation of cyclic GMP levels, stimulating the secretion of chloride and bicarbonate into the intestinal lumen via activation of cystic fibrosis transmembrane conductance regulator, or CFTR ion channel. It has also been shown to accelerate colon transit, and in some models, it has also been shown to have an anti-nociceptive effect, which may be relevant to irritable bowel syndrome with constipation, where of course pain is a major issue. The other prescription agent, plecanatide, stimulates secretion of chloride and bicarbonate into the intestinal lumen, mainly by activation of the cystic fibrosis transmembrane conductance regulator ion channel, resulting in increased intestinal fluid and accelerated transit. Lubiprostone works by activation of the CIC2 chloride channels, causing an efflux of chloride ions into the lumen, which in turn leads to an efflux of sodium ions through a paracellular pathway to maintain isoelectric neutrality. As a result, water follows sodium into the lumen in order to maintain isotonic equilibrium, thereby increasing intestinal fluid secretion. Prucalopride, in contrast, is a prokinetic, and it works by stimulating motility by interacting specifically with 5-HT4 receptors in the GI tract, which causes a release of acetylcholine and contraction of the muscle layer of the colon, augmenting colonic peristalsis and propulsion of its contents. Now, what do patients have to say about the current status of chronic idiopathic constipation therapy? Well, here there are some striking statements. 84% of patients say that symptoms associated with CIC and or its management often disrupt their everyday lives. As a clinician, I continue to be impressed by how much constipation impacts on patients. This is not a widely accepted fact. 62% of patients say that adverse effects from CIC treatments are sometimes worse than the disorder itself. And here they're particularly referring to diarrhea, urgency, and incontinence. 87% of patients wish there were treatments available with a different mechanism of action. So now I'm going to talk about a new study which is duly completed that I've participated in and which assesses a new mechanism of action. This is the vibrant system, which is a novel approach to constipation treatment. Before I talk about the study itself, I want to give you some background on the gut-brain connection, which truly is a new frontier in healthcare. For example, the gut-brain axis has been shown to play a role in the regulation of blood pressure. A link has been demonstrated between migraine, GI comorbidities, and the gut-brain axis. And the pathogenesis of Parkinson's disease is also thought to involve the gut-brain axis. In this very recent review, they looked at the disruption of circadian rhythms and its impact on gut motility. Excuse me. And they documented several lines of evidence to suggest that altered circadian rhythm contributes to the manifestation of constipation. And here on the right in the diagram, you can see a synchronized circadian rhythm leading to normal control of gastrointestinal function, whereas desynchronized, you get compromised esophageal, small bowel, colon, and rectal motility, and compromised gut microflora. Clinically, for example, patients with constipation demonstrate a significantly lower colonic pressure activity following waking or food consumption compared to non-constipated subjects. This is in contrast with the normal diurnal rhythm observed in non-constipated patients, where colonic pressure and pressure wave activity is higher in the morning. Although the number of mass movements did not follow a diurnal rhythm in constipated patients, it was blunted, and the percentage of patients with mass movements was less in the morning in constipated patients compared to healthy controls. So in summary, with regard to the circadian rhythms and gut motility, studies have indicated that patients with disrupted circadian rhythms present with gastrointestinal symptoms of disorders, most notably constipation and irritable bowel syndrome. Constipation has been associated with circadian rhythm-dependent differences in colonic transit following waking or food consumption, and the frequency of bowel movements compared to non-constipated subjects. Augmenting the circadian rhythm may provide a therapeutic benefit in the gastrointestinal system and may open a new avenue for interventions. Let's now talk about the vibrant system. So this involves a pod which activates capsules by transferring protocol parameters on activation to the capsule. And of course, it involves disposable capsules that are sealed and safe and environmentally friendly. So here's the method. First, you activate the capsule, and this is done by the patient placing the capsule in the pod for automatic activation. Then, the patient ingests the capsule, they swallow the capsule with a glass of water, and when it arrives in the colon, the capsule gently taps on the colon wall, lightly synchronizing the circadian rhythm via the enteric nervous system, thereby improving motility and predictability of bowel movements. But what is the evidence for this? This is a study we published a couple of years back, which looked at the effects of the vibrating capsule on colonic circadian rhythm and bowel movements in chronic idiopathic constipation. From this, we concluded that the vibrating capsule may increase complete spontaneous bowel movements by enhancing the physiological effects of waking and meals and augmenting circadian rhythm. And here you can see, comparing the active in blue to the sham in black, the augmentation of the circadian rhythm at these various points throughout the day. Now let's talk about the results of the phase 3 study, which are being presented at DDW this year. And this study looked at the efficacy and safety of Vibrant capsule for chronic idiopathic constipation in a randomized double-blind, multicenter, placebo-controlled phase 3 trial. Here's the trial design. Our patients had chronic idiopathic constipation with an average of 1 to 3 spontaneous bowel movements at baseline. The objective was to demonstrate efficacy, confirm safety, revalidate the mechanism of action identified in previous studies. The sample size involved 312 subjects with a 1-to-1 ratio between active arm and placebo. The primary endpoints were safety during 8 weeks of treatment, what's called the CSBM-1 success rate, which is an increase of at least 1 weekly complete spontaneous bowel movement relative to run-in during at least 6 of the 8 weeks of treatment. And then the CSBM-2 success rate, which is an increase of at least 2 weekly CSBMs relative to run-in during at least 6 of the 8 weeks of treatment. We also looked at some secondary endpoints, including change from baseline in average straining, average stool consistency using the Bristol Stool Scale, and also looked at quality of life. So here are the primary endpoints. When you look at the achievement of at least 1 complete spontaneous bowel movement over baseline, this was achieved in almost 41% of those with Vibrant, compared to 23% with the sham, a highly significant difference. Looking at the increment of 2 or more complete spontaneous bowel movements, this was achieved in 23% with Vibrant and 11% with placebo or sham, again, highly significant. Furthermore, we saw significant improvements in straining, stool consistency, and quality of life, as illustrated here. Indeed, Vibrant was effective in the most constipated group, in other words, those who had an average of 0 complete spontaneous bowel movements at baseline. And here you can see that whether you look at an increment of 1, 2, or 3 complete spontaneous bowel movements, this was significantly more likely to occur with Vibrant compared to placebo. 45 versus 21% for an increment of 1, 29 versus 12% for an increment of 2, and 19 versus 7% for an increment of 3, all highly significant. So adverse events revealed that there were no serious adverse events for Vibrant compared to placebo. And here we're looking at all gastrointestinal disorders, abdominal pain, vomiting, nausea, abdominal distension, and diarrhea. Really very little difference between active and placebo. On the treatment label, Vibrant will be indicated for patients with chronic idiopathic constipation who are aged 22 or more. For those who are over 50, a colonoscopy will be required as per screening guidelines. Furthermore, they must have taken laxatives for at least a month with no relief or with an inability to tolerate side effects. Exclusion criteria are important, and these include a history of complicated or obstructive diverticular disease, a history of intestinal or chronic obstruction or suspected intestinal obstruction, clinical evidence of current or significant gastroparesis, history of significant gastrointestinal disorders, including any form of inflammatory bowel disease or gastrointestinal malignancy. Celiac disease is accepted if the subject has been treated and is in remission. Other exclusions include a history of Zenker's diverticulum, dysphagia, esophageal stricture, eosinophilic esophagitis, or achalasia. The presence of a cardiac pacemaker, gastric electrical stimulator, or any electrical implanted device. Women who are pregnant or lactating are also excluded, as are subjects who are planning to undergo an MRI. So in summary, research suggests that augmenting the circadian rhythm may provide a therapeutic benefit in the gastrointestinal tract. The Vibrant system may increase complete spontaneous bowel movements by enhancing the physiological effects of waking and meals, thereby augmenting the circadian rhythm. Phase 3 clinical trials show the following: a 41% success rate in adding 1 complete spontaneous bowel movement per week above baseline, a 23% success rate in adding 2 complete spontaneous bowel moves per week above baseline. They also showed efficacy even in patients with an average of 0 complete spontaneous bowel moves at baseline. And importantly, there were no significant related adverse events such as diarrhea or nausea. And I would thank you for your attention.